Nursing Services.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 6 p.m. Now, get ready for more Ask the Experts.
Yes, we are back here with the Ask the Experts show. We're on every Monday and Thursday from 6 to 7 p.m. drive time. And try our new show we just added on Tuesdays from 7 to 7:30. It's our political show. And boy, is that the topic of everybody tonight. Tonight is the debate. We're waiting on Dr. Eric Shenben right now. He's one of the senior partners at Broward Urology Center. This is probably my easiest show to do because the way that Dr. Shenben explains everything to idiots like me, and I love having him on the show. It's the easiest 30 minutes. He's over here laughing. Good evening, Dr. Shenben. Okay, I'm not hearing you. Okay, I don't hear Dr. Shenben.
Sorry, I'd done that before.
Oh, there we go. Okay. I was trying to read your lips before. So you're one of the partners at Broward Urology Center. Tell everybody about your practice.
So we're located in South Fort Lauderdale or Southeast Fort Lauderdale. And currently we're a group of 3 urologists, general, although myself and one of my partners are fellowship trained in endourology, laparoscopy, robotic surgery, minimally invasive urology, and really have an emphasis of that in our practice. Although we do see the full breadth of urology, I've started to really kind of find some self-interest and specialization in sexual medicine. I see a lot of it outside of urology, and I think we as certainly the men's health specialist, and as well work with many women as well. I think that we really should have a better handle and control on that with men instead of just a whole bunch of random practitioners that have gotten into the field.
Eric, have you noticed that men are afraid to come into a clinic when they're suffering from ED? They're a little embarrassed, and that probably the hardest part is getting them to come in.
Well, I think that it is a little bit of a sensitive, embarrassing topic when it comes to someone's just general sexual health, whether it's sex drive, libido, as we call it, ED. Guys have premature ejaculation issues, even infertility. That it challenges a man's machismo, and are they less of a person, less of a man, and it can be very embarrassing. But I think we try and make it that it's part of a whole spectrum of medical disorders, and something that we have so much more at our armamentarium now to treat and manage. And I think, historically, Viagra, going back to the Honeymooners show,
Right.
and really desensitizing people. I'd say sometimes we've desensitized some stuff, like on the internet, a little too much, and patients will have some of these problems: psychological erectile dysfunction from pornography addiction and a number of other things. And that's why I also work with some sexual therapists as well for stuff like that. So it's not always physical. There is psychological factors as well, but I think that we really try and make men comfortable here and be able to speak their mind and help them with their problems.
You see patients like this all the time. This is not something that, I mean, you actually specialize in this area.
It's something that I really tried to focus on and got to do some extra course training and emphasis. I mean, we are the penis specialists, but I think there's much more to it. I've gotten in the last 5 to 10 years to doing a lot of testosterone replacement. We see it more and more. And like I said, we're the men's health specialists, and I think we really need to take a hold of that as urologists as a whole.
So tell me, and we were always getting new listeners. What are some of the causes of ED?
Well, I heard it on the broadcast, that sort of the sort of commercial, I guess, you guys have for the practice. But some of the most common ones, especially when it relates to a known underlying disorder: diabetes is a huge one, hypertension or high blood pressure, low testosterone, like I just mentioned, really big one. And sometimes just fixing the testosterone can fix the erectile dysfunction. Not always, but sometimes. Then we get to more broad, longer term, not always be able to put your finger on it: cardiovascular disease, atherosclerosis. We think about the arteries in our heart clogging up, but the arteries to the penis are much smaller, so those can certainly clog sooner. So sometimes some studies have shown erectile dysfunction can be a predecessor to heart disease and neurologic dysfunction. And some of that neurologic dysfunction is not necessarily having a brain tumor or having Parkinson's disease, although all kinds of neurologic disorders can do that. But a lot of people will have back issues, spinal cord issues, strained back issues, and so on, that can affect the erections as well. May have been an old injury, may have been something that's very subtle, but if you tease it out, you may be able to figure out some of the causes.
What I like about Broward Urology Center, because you see all these ads for ED, usually for a pill or cream. I mean, who do you want to trust? Do you want to trust a urologist that practices in this, or some ad that says, guaranteed 3 inches longer? I mean, I don't understand why someone would not come to a urologist for that versus a little ad in the paper.
I think sometimes it's a little sensationalism, but I certainly have to agree with you. I think some of the newer treatments, the regenerative treatments that we're going to talk about probably in the latter half of the show, I think as a whole, we as the urologic community have not wanted to embrace them because we'd like to see randomized, double-blind, placebo-controlled trials, and those are actually being done now. Certainly with the Shockwave stuff, on some newer equipment, and we're very much rigid in medicine. But I think, and I was a skeptic for many, many years, but I think that when you see something with your eyes, and maybe at least someone else has played the guinea pig role with the patients, for a number of years, and that you can really help people. And if people are going to have to pay for some of these treatments out of their pocket, I think they're going to be far more a critic to say this was not worth it, this didn't help me at all. We certainly all like to know why. I usually give the analogy of Chinese medicine. We don't always have a study, and holding a treatment back that might have no negative side effects, if we can help the patient. Certainly not 10% of the time, but if we can help the patient and not hurt them, I think there's some benefit there. And certainly we also need to study what we're doing, which hasn't been done a lot outside of urology.
So there's got to be so many new things out there, new treatments in the market. What are you seeing out there?
Well, I think that, there is, even now, touching on low testosterone, because we did mention that can be a big cause, or at least part of the cause for erectile dysfunction. We know erections are testosterone dependent, but there's even an oral medication. Now, haven't even had the rep come by my office yet, but it's sort of new, just hitting the market, of a pill,
Oral
which we had visited
testosterone?
years ago. Say again?
It's an oral testosterone?
It's an oral testosterone. Now, years ago, we had that long before I was a doctor, and unfortunately, one of the pill that was out there was causing some liver cancer and so on. So obviously, that got taken off the market, and we usually use injections and gels and pellets now. And when I have a little more to learn about it and firsthand, then I'll consider it. But right now, again, I'm a skeptic on that oral pill. But
Right.
what I was also getting at is, when we replace guys' testosterone, a lot of them complain that their sex drive is low. And most of the time that comes back with testosterone. And we're not talking about crazy levels. I'm just trying to get a guy back to a healthy, normal level that he feels more back to himself again. And there are some other treatments out there, something called peptides, that I've just started prescribing. And these are small molecule chemicals that we make, like a pharmaceutical medication, that mimic certain proteins, enzymes, and compounds that are actually in the body. And some of them, like peptide PT141, can be used to help with libido. There are some others, like oxytocin, and a few different uses in sexual medicine that, again, I'm starting to try and fill the gaps. For example, these men that have low T that we replace and are back to health in other areas, but libido is still kind of low. So that's one of the other ones that's out there, I think. And
You would not believe this, Eric. We have got 5 texts, all basically asking the same thing. They want to know, when you have something new presented to you, how do you test it to where you feel good about using it? I guess they were talking about the testosterone cream.
so, I mean, certainly, I may be on the earlier side of adopting things, but I'm not one of the people that likes to adopt something the moment it hits the market, or even before it hits the market, and so on, unless we're a part of a clinical trial involved with the company and really investigating the drug, the medication, and so on. I think you kind of have to cherry pick some of the patients you're going to choose things on first. Not going to treat that 79-year-old guy with diabetes and heart disease. I'd rather treat the 40, 50, 60-year-old healthier guy with, let's say, a low testosterone in this instance, and so on, and no other medical issues and so on, that at least I feel a little more comfortable. There's not going to be so many other factors and other potential problems, interactions with other medications, and so on. I think that's how I would
And as a
adjust.
doctor, you're going to do a history and physical on someone first, rather than someone ordering a pill through the mail that's, it's not good for everybody. But you're actually going to sit down with the patient first and try to find out what's causing it.
For sure. for sure. I mean, we're still doctors. I think, factory, conveyor belt medicine has gotten to be too much. They've pushed a lot of us, all of us physicians, into really trying to move faster and spend less time with the patients. And I try and focus my questions, but really tease some history out of a man that if you spent an extra, literally 3 or 4 minutes getting that information, it can really save you from going wrong directions in treatment options and figuring things out that really help you get to your goal and treating patients properly with the right amount of treatment they might need and so on. I think that's, as a urologist, further testing we do with ED with penile Doppler ultrasound is not something that many other practitioners use. They're not comfortable using it. They haven't grown up with it. And it's an objective test that we can put to the subjective information that you have to get by actually talking to someone, and then really formulate a comprehensive treatment plan that is specific to that patient, as opposed to just walking into one of these other non-urologic clinics and saying, well, I have ED, and they say, okay, I have a treatment for you. Here's the sign-up paper. And they said, wait, I haven't told you anything yet. And the answer is, well, you have a penis, you must be the same as everyone else. And while that is a generalization and there's some truth to it, it's far from the exact truth. And I think we really have to individualize treatment.
One more question before we go to break. Eric, since you're a physician, does insurance cover ED, the treatments?
So unfortunately, insurance doesn't really cover much of the treatment at all. Even back in the last 10 years, some insurances were covering a fair amount of Viagra, Cialis, Levitra, those kind of oral medications. And even though they're generic now, very few insurances are covering it. Now, that said, I even have, I've had generic medication in the office, the generic equivalents of the brand name drugs, for a number of years. And certainly when I started bringing it into the office, these drugs were $75 to $86 a pill, and very few places really had the generic equivalent, so men couldn't afford anything other than the generic, so it was helpful. But the prices have really come down. Just most pharmacies have them now. We still have them in the office, and a lot of times you can find them even cheaper in the pharmacies themselves. So I think that really has helped people out.
What about when you get into testosterone or some of these other major treatments you do? Insurance doesn't cover it there either.
Well, testosterone, it's funny because a lot of the patients go to these testosterone replacement and erectile dysfunction kind of clinics. You see spinning the sign on the side of the street. There's no one spinning a sign outside our office. We have a sign, but no one's spinning it.
Yes.
And I say to the patients, your insurance would cover your testosterone. You're paying cash out of your pocket. We're happy to take your cash, but why don't you let us at least give it a try, or ask your other doctor who's doing it, to put it through your insurance. For the ED, we try and I kind of work a hybrid model, and we're a traditional medical practice, so it's not cash only, and we run everything through your insurance. Now, of course, your insurance will cover visits with the doctor for ED, unfortunately not the treatments. And so then when it comes to the treatments, anything that's left over, that's how we handle things. But even the injectable medication like Trimix that we use sometimes, that you'll see in these erection clinics, I've seen patients paying $500 to $1,000 a vial for something that costs, maybe $130, $150 at some compounding pharmacies. And that's something we send you to. So there's a lot of wool being pulled over the eyes, I think, of what patients have, and so on and so forth.
Okay, Eric, give everybody the phone number at the office if they'd like to call and sit down with you and make an appointment.
So our main office number is 954-463-6408. And you can also get us through our website, at www.browardurologycenter.com. And you can even find us on Facebook these days too.
Okay, we're going to go to break, and we come back. We'll have more with Dr. Shenvin. He's one of the senior partners at Broward Urology Center. We'll be right back.
You are listening.
Are you suffering from erectile dysfunction, also known as ED? The urologists at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
This is the Ask the Expert show. We're on every Monday and Thursday from 6 to 7 p.m. drive time. And we have some of the top experts in their fields, local, and also our shows are live. Most of the shows out there nowadays, talk shows, are pre-recorded, not us. Our shows are live. We're here with Dr. Eric Shenvin. He is one of the senior partners at Broward Urology Center. We're talking ED tonight. And gosh, someone just asked, and I should know this because I've asked this before, Eric, about having for testosterone, the injections under the skin. They wanted to know if your clinic does that.
It's something that's a little more on the newer trend, what would be referred to as subcutaneous, or just under the skin injections, really in the fat layer, as opposed to the traditional testosterone injections, which are in the muscle. And again, like I mentioned before, it's one of those things I want to learn a little bit more about before I just jump in and change everything we've been doing for the last 5-10 years. I think that the subcutaneous injection would be nicer because the muscle sometimes can be a little more sore to inject in and so on. But it's sort of something new, I think, that's on my horizon, and I'm looking into a little further currently.
There's this shockwave machine. Can you tell us about that?
Sure. So shockwave therapy, or low intensity shockwave therapy, not to be confused with what we've been doing since around the early 1980s for kidney stones, which is shockwave therapy, as you may refer to, much, much higher energy levels. This shockwave therapy is for erectile dysfunction. We're also using it in women for female sexual dysfunction, urinary incontinence, overactive bladder, a little more utility even in women than men, but we'll just leave it to male sexual dysfunction for today. And the shockwave therapy is actually causing a low level of trauma to the cells. Kind of the analogy I give is like when you cut yourself and the body immediately reacts. Our bodies are really smart and a really fancy high-tech machine. So when we cut ourselves or bruise ourselves by banging our elbow on the doorknob or something like that, then you're going to get really initially a platelet response. And that platelet response comes in, and any blood vessels that are bleeding, it tries to plug them up. There are clotting factors that jump on to stop the bleeding. And then what we've learned more recently in the last 10 years is that the platelets are releasing these growth factors and signaling proteins, telling all the other cells to come on in that are involved in the healing process. Kind of, I think of the platelets as the Marines, and then they call out for the rest of the armed forces. And it's resulting in the cells coming in that normally wouldn't. If you think about ED, it's gone very kind of quietly and slowly and silently under the radar, if you will, because there wasn't any real severe acute event like cutting your hand, getting a paper cut, and anything like that. So by doing the shockwave, we're not using such high energy, like I mentioned with the kidney stones, where we can actually cause damage to the tissue, but we're causing enough to what I call kind of shake up the cells, trick them into thinking there's trauma and damage, and that kicks off the cascade, the healing cascade, even to the point where the platelets are stimulating stem cell production and can even try and help kind of clean out the blood vessels, maybe even help repair nerves, and really get the erections working more back to normal.
Well, I guess this is a way coming towards the end of the show. We've had two females ask how come you don't do a show on females, but you do see females.
We do. I do. And I think just because you might call me the male gynecologist, but we're still the ones that deal with women's overactive bladders and incontinence and bladder cancer and kidney stones that both sexes get. We still see probably about 25% women. So certainly the men are much easier to get in my door. Women also with sexual function, they're just a lot trickier to treat. And again, I have treated some women. I would like to treat more women. Again, they're a little harder to get in. Women don't quite notice when their sex drive goes down as much. It's sort of something pre-programmed that we think about in society, that when women hit menopause, maybe they should just throw the towel in anyway, and so on. Now, some women don't have that effect, but I think it's certainly more than 50% of the majority that women will see a drop in their sex drive. They're having the hot flashes. They don't feel as sexy or as wanting to be intimate, and so on. Men, I think, remember, at least for a while, their libido, what it was like, and kind of wonder what happened. Men also have more outwardly erections that they get, and they see the morning erections, that sort of the body's natural maintenance mechanisms. Remember, procreation is the number one thing that our sexual organs are made for, to continue our species. So men have a little more outward appearance as a reminder of their sexual function than women do. So that's why at this point I've focused this sexual medicine stuff on men, and really my next thing is to tackle women. Not so easy, but really try and work with my gynecology fellows and so on. And I guess what I didn't get to mention before is I've been trialing this new shockwave machine in the office, which is very cool in that it is a miniature version of our kidney stone machines. And what I've been using, the traditional machine that's out there, is what we call a radial device. And think of it as a much smaller head that we treat with on the penis. And you think about it, it's like dropping a stone in a pond. We all remember the rings that you get. Those are shock waves. So that's a much more direct effect. Whereas this newer type of kidney stone machine that works by the same kind of technology as, the new penile shockwave machine, same technology, can be done without any pain medication at all.
Give everybody the phone number.
We're always running out of time, Steve. It's Broward Urology Center, and the number here is 954-463-6408.
I love the show. We'll be back again with you next month. Get your questions ready. Maybe we'll even take some phone calls. Eric, I love doing the show with you. It's so nice having a physician do a show like this. And we will be back again on Monday at 6 o'clock. Thanks, Eric. Broward Urology Center.
Thank you, Steve. Stay well.
Thanks for listening to the Ask the Expert Show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve.